It's reserves. Gentleman from Oklahoma is recognized.
Thank you, Madam Speaker. As I'm just quickly, because I'm sure my good friend from Massachusetts, I yield myself such time as I may consume.
Gentleman's recognized.
I'm sure my friend from Massachusetts is not aware of this, but Ms. Miller Meeks has actually run multiple events for vaccine. She's vaccinated people herself. She has spent 24 years in public health and in service to the country. So I agree with you about the vaccine. Nobody in this body has done more to promote it and administer it than Ms. Miller Meeks. Madam Speaker, to speak more about the need to ensure illegal immigrants are tested for COVID-19 before being released, I yield 3 minutes to my very good friend, the distinguished lady from Tennessee, Ms. Harshbarger.
The gentlelady is recognized.
Thank you, Madam Speaker. I rise to oppose the previous question so that we can immediately consider H.R. 1897, the REACT Act. It's urgent that we pass this critical and common sense legislation offered by my friend and colleague from Iowa, Ms. Miller Meeks. We all know that the crisis on our southern border is a national security crisis. My colleague, Ms. Miller Meeks, is a physician and I'm a pharmacist, so we totally understand. What's less discussed is that it's also a public health crisis. Illegal immigrants are coming across our southern border in record numbers, and they're coming from countries with low COVID vaccination rates. And my colleagues are right. The hospital, the ERs are full of a lot of unvaccinated people because there's 200,000 or more coming across the southern border every month, and 208,000 were encountered in August alone. And the Biden administration is then transporting these illegal immigrants to communities all across our country, in most cases without the governor's approval, as is in Tennessee. Currently, there's no requirement for individuals released by CBP or ICE to test negative for COVID before they're released. That means that any COVID-positive migrants released by the administration are spreading COVID throughout our communities. Just this week, the DHS secretary admitted that there are at least 12,000 or more Haitian migrants released into our communities were not subject to COVID testing mandates. And I won't even talk about the non-SFE Afghanis. Contrast this with the Biden administration's policy of forcing American workers to get tested or vaccinated, or its policy of only letting fully vaccinated tourists fly into our country. The lack of COVID testing at the southern border is reckless and it's unacceptable, and it's a detriment to our healthcare system. But it doesn't have to be this way. There is a solution to the border health crisis. My friend from Iowa introduced the REACT Act to protect American public health from the border crisis. This critical bill would require testing for everyone crossing our border, and it would require a negative test before CBP or ICE can release these illegal immigrants from custody. You know, the ultimate solution is just to close the border, but since that's a common sense solution, it's not going to happen. It's time to implement the proper health screenings for these individuals entering our country and stop putting Americans at risk. The House should immediately pass the REACT Act because lives depend on it. And with that, I yield back my time.